All right, let's dive into Earth's medicine cabinet today. We're tackling a condition that affects a ton of people, blood pressure. But we're not just talking about the basics here. We're zeroing in on a type you might not be as familiar with. It's called isolated systolic hypertension, or ISH for short. Now, it's especially common in people over 65. But even younger adults can have it, and that's important to remember.
You're absolutely right, and ignoring it can have some pretty serious consequences.
Okay, so before we get into the specifics of ISH, let's just quickly recap blood pressure in general. We hear those numbers all the time, like 120 over 80. But what are those numbers actually telling us?
Well, those numbers represent the force of blood against your artery walls, kind of like the pressure in a pipe. The top number, that's the systolic pressure. That's the pressure when your heart beats and pushes the blood out. And the bottom number, the diastolic pressure, that's the pressure between beats when your heart is resting.
So with ISH, it's that top number, the systolic pressure, that's high, even if the bottom number is totally normal. Someone might see a reading like 150 over 70 and think they're fine because that bottom number is in the healthy range.
Exactly, and that's why it often gets missed. But here's what's fascinating about ISH. It's not just a random high number. It can actually be a big warning sign, a signal that other health issues might be developing, like an increased risk of heart attacks, stroke, even things like cognitive decline.
That's definitely a bit unsettling to hear. So what kind of numbers are we talking about here? How do we know if we're in that ISH zone?
Well, if your systolic pressure is consistently 140 or higher, but your diastolic pressure is below 90, that's generally considered ISH.
So even if that bottom number looks great, a high top number is still a serious red flag. Why does this happen, though? What's actually going on in the body that causes ISH?
Okay, imagine those flexible tubes gardeners use. Our arteries are kind of like that, and as we get older, those arteries can stiffen up and lose their elasticity. It's a natural part of aging. And just like it takes more pressure to push water through a stiff hose, it takes more pressure to push blood through those stiffer arteries.
Ah, so the heart has to work harder to pump the blood through, which drives up that systolic pressure.
Precisely. And on top of aging, there's also plaque buildup, those fatty deposits. That can also contribute to that stiffening of the arteries.
So it's like a double whammy. Aging and plaque buildup can both make it harder for blood to flow freely. Are there other things that can play a role in ISH? Besides just getting older, I mean?
Absolutely. There are a number of conditions that can impact the circulatory system and potentially lead to ISH. Anemia, for example. When you don't have enough red blood cells to carry oxygen effectively, that can force the heart to pump harder, which puts more stress on the blood vessels. And diabetes, if it's not well managed, can also damage blood vessels.
Wow, it's really interesting how interconnected all these conditions are. So it's not just about blood pressure in isolation. It's about the health of the entire circulatory system.
You got it. And then we have things like hyperthyroidism, an overactive thyroid gland. That can disrupt the heart's rhythm and affect the circulatory system as well. And even sleep apnea, where your breathing repeatedly stops and starts while you're sleeping. That can also put strain on the cardiovascular system over time and contribute to blood pressure issues.
Wow, it's incredible how everything in the body is connected. So we've talked about what ISH is and some of the things that can cause it.
Yeah.
But why should people be so concerned about it? What are the potential consequences of just leaving ISH untreated?
The problem is that high blood pressure, including ISH, often doesn't have noticeable symptoms in the early stages. It's often called the silent killer for that very reason. You might not feel any different, but damage could be happening inside your arteries.
And that damage can lead to some pretty serious complications down the line, right?
Unfortunately, yes. Untreated ISH can significantly increase the risk of heart attack, stroke, heart failure, even aneurysms, which are those weakened spots in artery walls. That can be life-threatening if they rupture. And it's not just limited to the heart. ISH can also increase the risk of kidney disease, vision problems, and even cognitive decline.
So it's not just one isolated problem. ISH can have ripple effects throughout the body, increasing the risk of a whole bunch of health issues.
Exactly. That's why it's so important to be aware of your blood pressure numbers and understand what they mean. Early detection and management are really key here. It can make a huge difference.
Okay, so last time we left off talking about some of the pretty serious health risks linked to ISH, but I'm curious, what can we actually do about it?
Sure.
How can people manage ISH and bring that systolic pressure down?
That's the good news. ISH is often very manageable. The main goal is to lower that systolic blood pressure, ideally below 140. And just like with other forms of high blood pressure, there are two main ways to do that: lifestyle changes and medication. And often a combination of both works best.
All right, so let's start with those lifestyle changes. What are some of the most important changes people can make to really address their ISH?
Well, a lot of these are things we hear about for general health, but they're extra important for managing ISH. First off, maintaining a healthy weight is crucial. Even losing a small amount of weight can make a real difference in your blood pressure. And then there's the DASH diet. It stands for Dietary Approaches to Stop Hypertension.
Oh yeah, I've heard of the day S diet, but to be honest, I'm not exactly sure what it involves.
It's actually pretty straightforward. Basically, imagine filling your plate with colorful fruits and veggies, whole grains, lean proteins, and low-fat dairy. That's the core of the day stage diet. It's all about eating foods that are naturally lower in sodium and packed with nutrients that are good for your heart.
It sounds pretty tasty too, like a delicious and satisfying way to eat.
It really is. Another important part of the DSH diet and managing blood pressure overall is cutting back on salt.
So how much salt should people actually aim for each day?
The general recommendation is to stay under 2,300 milligrams of sodium per day. But of course, that can change depending on individual needs and health conditions. It's always best to chat with your doctor to figure out what's right for you specifically.
Okay, so diet is a big piece of the puzzle. What else should people be focusing on in terms of lifestyle?
Well, regular exercise is essential too. It doesn't need to be anything crazy intense. Even moderate activities like brisk walking, swimming, or dancing can have a really positive impact on blood pressure. And of course, if you smoke, quitting is honestly one of the best things you can do for your heart.
Now, what about alcohol? Does that play a role in ISH at all?
It can, so moderation is key. The general guidelines suggest up to 1 drink per day for women and 2 drinks per day for men.
So it sounds like making healthy choices across the board is really important. But what about medication? When do you typically recommend that for managing ISH?
Medication is usually recommended when lifestyle changes alone aren't enough to control blood pressure, or if someone has other risk factors, like diabetes or kidney disease, for example.
I see. What are some of the common types of medications used for ISH?
There are several different classes of medications, and they all work a little differently to lower blood pressure. Diuretics, for instance, help your body get rid of excess fluid and sodium, which can reduce blood volume and lower pressure. Then there are ACE inhibitors, which block a hormone that causes blood vessels to constrict. Basically, they relax the blood vessels, make it easier for blood to flow, and that reduces the pressure.
So it's not a one-size-fits-all situation.
Yeah.
There are lots of different options. And it's about figuring out what works best for each person.
Right. The best approach is always going to be personalized, based on your own specific needs and health history. It's why it's so crucial to have those open conversations with your doctor.
Absolutely. They can help determine the best course of action.
Sure.
Speaking of talking to your doctor,
Mm.
do you have any tips for how to have more productive conversations about blood pressure? I know sometimes I'll walk out of an appointment and realize I totally forgot to ask some of my questions.
Oh, I know that feeling. It's helpful to be prepared before your appointment. Like, write down any questions or concerns you have, even the ones that seem silly. And bring a list of your medications and any supplements you're taking.
That's a great tip. It's easy to forget things when you're in the moment.
For sure. And don't be afraid to really advocate for yourself. Ask your doctor to explain things clearly until you feel like you understand your situation and all of your treatment options. Remember, you're a partner in your healthcare journey.
I love that. Being an active participant instead of a passive patient.
Exactly. And being honest with your doctor is important too if you're struggling with any lifestyle changes or having trouble taking your medication as prescribed. Those are all important things to talk about.
So it's all about open communication.
Ooh.
And working together as a team. We've talked a lot about monitoring blood pressure, but I imagine it's hard to get the full picture from just those occasional readings at the doctor's office.
You're right. That's where home blood pressure monitors come in. They're pretty inexpensive and easy to use these days, and they let you keep track of your blood pressure outside of those clinical settings.
Do you have any advice for choosing a monitor? I've seen so many different types out there.
I'd recommend talking to your doctor or pharmacist. They can help you pick a monitor that's accurate and one that fits your needs. Also, make sure to look for a monitor that's been validated by a reputable organization, like the American Heart Association.
Okay, that makes sense. So once someone has a monitor, how often should they be checking their blood pressure at home?
That's a great question. And again, it's best to talk this through with your doctor, since the ideal frequency really depends on your individual situation. But in general, for someone managing ISH, checking a couple of times a week at different times of day can be helpful to see any trends.
Are there any specific times a day that are better for check?
It's good to check first thing in the morning, before you take any meds or eat breakfast, and then again in the evening before dinner. That way you can get a sense of how your blood pressure changes throughout the day.
So it's all about being consistent and looking for those patterns over time instead
Mm.
of focusing on just one single reading.
You got it. And if you notice your readings are consistently high, that's definitely a sign to reach out to your doctor.
We've covered a lot of ground in terms of concrete steps, like making those lifestyle changes and potentially taking medication. But I think it's important to acknowledge the mental and emotional side of things too. Managing a condition like ISH isn't just physical.
Absolutely. Living with any chronic condition can be stressful. And we know that stress can impact blood pressure. So managing stress is actually a really crucial part of managing ISH, even though it often gets overlooked.
It's true. It can become a vicious cycle. Stress, raising blood pressure, and then worrying about the high blood pressure causes more stress.
Exactly. So it's key to find healthy coping mechanisms for dealing with stress. Things like exercising, spending time in nature, connecting with people you love, practicing mindfulness or meditation, even just doing activities that you genuinely enjoy. These can all be incredibly helpful for managing stress.
It's like building your own personal toolkit for stress relief. Are there any particular stress reduction techniques that you find helpful?
You know, for me personally, spending time in nature is huge. It's such a powerful way to combat stress. Whether I'm going for a hike, gardening, or just sitting under a tree, being in nature helps me feel grounded and centered.
I feel that. There's something about being in nature that just calms the mind.
Totally agree. And it doesn't even have to be some big elaborate thing. Even small things like taking a few deep breaths, listening to some calming music, or just practicing gratitude. Those can all shift your mindset and help lower stress.
It's about finding those small moments of peace throughout the day. So it sounds like managing ISH is really a holistic thing. It's not just about the physical symptoms, but also taking care of our mental and emotional well-being.
Well said. It's about understanding how our physical, mental, and emotional selves are all connected, and finding ways to nurture our overall well-being.
We've covered a lot about the more conventional approaches to ISH, lifestyle changes, medication, and stress management. But I want to shift gears a little bit and talk about something I'm always fascinated by. Earth's medicine cabinet. What role can it play in supporting our hearts?
Oh, I'm with you there. There's definitely growing interest in exploring natural options, and for good reason. Nature is full of incredible plants and compounds that have been used for centuries to promote health, and many of them have shown real promise when it comes to heart health.
Okay, so let's open up that medicine cabinet and see what we've got. What are some of the top contenders for natural remedies for ISH? Or just for heart health in general?
Well, one that always comes up is garlic. I mean, it's a kitchen staple, but it also has a long history of medicinal use. Research suggests it might help lower blood pressure and cholesterol, and maybe even help prevent blood clots.
Wow, I use garlic all the time when I cook. But I never knew it had all those heart-healthy benefits. How does it work exactly?
Garlic contains this compound called allicin. It gets released when you crush or chop garlic. And allicin is thought to have this relaxing effect on blood vessels, makes it easier for blood to flow, and that could help lower blood pressure.
So it's like a natural vasodilator. That's so cool. What are some other natural allies we can turn to for help with ISH?
Another one that's getting more attention lately is hawthorn berry. It's been used in European herbal medicine for a long time, especially for heart conditions. Studies suggest that hawthorn might help improve heart function, increase blood flow, and even strengthen the heart muscle.
Hawthorn berry. It sounds almost magical.
Right. It does have this sort of mystical quality to it. It's packed with antioxidants and flavonoids. Those are plant compounds that have all sorts of benefits for the cardiovascular system.
That makes sense.
Yeah.
So garlic and hawthorn berry are two great options,
Yeah.
but I'm sure there are more treasures hiding in Earth's medicine cabinet.
Oh, absolutely. We can't forget about omega-3 fatty acids. Our bodies need them, but can't produce them on their own. They're in those fatty fish like salmon, mackerel, and tuna. And also plant-based sources like flax seeds and chia seeds.
Right, omega-3s, I know they're important for brain health. But how do they actually help the heart?
They have powerful anti-inflammatory properties, which is crucial for protecting against heart disease. They also might help lower blood pressure and triglycerides. Those are fats that circulate in the blood and can contribute to heart problems.
So it's like a three-pronged approach.
Yeah.
Fighting inflammation, lowering blood pressure, and keeping those triglycerides in check.
Exactly. And then there's CoQ10, sometimes called ubiquinone. It's a substance found naturally in our bodies, and it plays a key role in energy production within cells. Especially important for the heart, right? Since it's constantly working and needs a lot of energy, CoQ10 helps make sure that energy production is running smoothly in the heart.
Ah, so it's like the fuel that keeps the heart engine going. I've heard of CoQ10, but I'm not really familiar with it. What kinds of foods is it found in?
You can find it in small amounts in things like organ meats, fatty fish, and whole grains. It's also available as a supplement. Some studies suggest that CoQ10 supplements might be beneficial for people with certain heart conditions, but more research is definitely needed in that area.
Interesting. I'll have to look into that. Are there any other heart-healthy superstars we should know about?
Well, we can't talk about heart health without mentioning magnesium. It's a mineral that's involved in regulating blood pressure, muscle function, and even blood sugar control.
Magnesium, yeah. I know it's good for sleep and relaxation, but how does it specifically help the heart?
It basically helps keep those blood vessels nice and relaxed, which can lower blood pressure. It's also important for maintaining a healthy heart rhythm and supporting the function of the heart muscle.
Makes sense. What are good sources of magnesium?
Leafy green veggies are great. Almonds, avocado, black beans, even dark chocolate, which is a nice little heart-healthy treat.
Oh, I'm on board with that. You're making me want to stock my pantry full of all these amazing foods. It's incredible how much support we can get from nature for our hearts.
It really is. But before we get too carried away, I do want to add a little word of caution. While these natural remedies can be great additions to a heart-healthy lifestyle, they're not a substitute for conventional medical treatment, especially if you've been diagnosed with a condition like ISH.
That's a really important point. So it's not about choosing one or the other. It's about finding the right balance between natural approaches and conventional medicine. And of course, always talking to your doctor.
Exactly. And even natural substances can have side effects or interact with certain medications. So it's key to do your research, talk to your doctor, and be cautious, especially if you have any underlying health conditions or you're currently taking any medications.
It's all about being informed and making those smart choices for your health.
I couldn't have said it better myself. Remember, nature's amazing, but it's not magic. True well-being comes from a holistic approach, nourishing our bodies with healthy foods, moving regularly, managing stress, and cultivating that sense of inner peace.
I love that. It sounds like we've reached the end of our deep dive into isolated systolic hypertension. I hope everyone listening feels empowered with knowledge and inspired to really take charge of their heart health.
I hope so too. Remember, knowledge is power. And when it comes to our health, there's no better investment than investing in ourselves.
Absolutely. We've explored all sorts of strategies, lifestyle changes, medications, natural remedies. The key is to find what works best for you and to work closely with your healthcare provider.
It's all about creating your own personalized path to heart health, one that fits your individual needs and preferences.
As we wrap up, let's not forget that Earth's medicine cabinet is always there, offering an abundance of resources to support us.
From the food we eat to the way we move our bodies and manage our stress, we have so many ways to tap into nature's healing power.
So let's keep exploring, learning, and making choices that nourish our hearts and minds.
Here's to a life full of vitality, resilience, and a deep appreciation for the connection between it all.
Thank you so much for joining us on this journey. Until next time, may your hearts be healthy and your spirits bright.